Australians with long COVID say they fear more people will develop the condition now and they are at risk of reinfection now. People with the virus don't need to isolate. Bethany Wormald, 46, who has long COVID, is petrified of catching the virus again in case it makes her even more ill. Wormald has an appointment at Sydney's long COVID clinic, but not until December. Read more. People in NSW no longer required to register positive COVID-19 tests. She has been on the waiting list since June. On the one hand, governments are scrapping isolation and mask requirements, but on the other hand, they are not increasing resources to handle long COVID sufferers, she claimed. Long COVID is officially recognized by the World Health Organization. It's classed as a condition suffered by those who had COVID-19, which lasts for at least 2 months. Symptoms include fatigue, shortness of breath and cognitive dysfunction, or brain fog. It's not known exactly how many Aussies have it, but it is thought to be at least 500,000 based on estimated figures. Wormald, who had COVID-19 6 months ago, used to be a runner, even setting a Guinness World Record for finishing a marathon dressed as a TV character, Betty Rubble from the Flintstones. But now, thanks to what she has been told as long COVID, the stepmother spends 23 hours a day in bed or on the couch in Fingal Bay, NSW. Read more. I feel like I've died. Desperate pleas of women with long COVID. She has had to cut her hours working in communications from 40 to just 12 a week. Wormald, who had 3 vaccinations for COVID-19, said she's worried about the removal of rule and thinks the government is creating a predictable problem. Her fatigue is so bad she struggles just to walk around her house, and has to rely on her husband for most things. I have trouble having the strength to sit up, she said. It is awfully hard to deal with. She also has postural orthostatic tachycardia syndrome, which means her heart rate surges when she stands up. Meanwhile, single mother of 2, clinical psychologist Ruth Nelson, 42, has had COVID-19 twice, and ended up in hospital for weeks both times. She developed long COVID after the first infection, and says her symptoms worsened after she got it again. Nelson, who is triple vaccinated, lists her ongoing long COVID symptoms as fatigue, chest pain, palpitations, brain fog, headaches, nerve pain and other problems, and dizziness and fainting. She has to use a walking stick to get around. The inner West Sydney mother is back at work this week after working from home for months and using up all her sick leave. She said she's terrified about having to mix with people again amid the scrapping of rules. While she praised the Sydney long COVID clinic she goes to, she's seen little progress. Read more. Source of COVID-19 on Ruby Princess disputed in class action court hearing with COVID the second time. The long COVID is worse, she said. Even having a shower now is a mammoth task she has to break down into easy parts, she said. It's a far cry from her life before. I'd take the kids camping, go for road trips, drive up to see my mum in Queensland, kids swimming lessons, karate, she said. She said her outlook changes depending on how she is feeling. I assume I will get better. And at the same time I accept the reality I am going to catch COVID again and that's just going to be my life, she said. Thoracic doctor, Associate Professor Anthony Byrne from St. Vincent's Hospital in Sydney, said reinfection with COVID-19 can make long COVID worse, but there's only limited data available. There was a survey sent out to people in the UK with long COVID and it found those with repeat infection. There was a worsening of symptoms in most of them, Byrne said. He also said that with so many different vaccine variants, and many places in the world having low vaccination rates, herd immunity against COVID-19 is unlikely. He said he thought the government move to cut fines for failing to isolate is appropriate, but the messaging isn't great. "There's a big difference between what's the rule and what's mandatory and what's sensible," he said. "If you're unwell with an infectious disease, maybe you should go to work." He urged the federal and state governments to ensure long COVID clinics are properly resourced, saying people are waiting months and months and months for appointments. "It's really frustrating. I think what needs to happen, and hopefully what is happening with the parliamentary inquiry, is there's some decisions about resourcing those clinics." The federal government said Chief Medical Officer Paul Kelly had advised National Cabinet mandatory isolation could be removed due to low community transmission and high hybrid immunity from both vaccination and recent infection, as well as ready access to vaccines and treatments. A government spokesperson said a national response for the management of long COVID in Australia is being prepared by the Department of Health and Aged Care and the Chief Medical Officer. Submissions are also being sought on an inquiry into long COVID and repeated COVID infections to the House Standing Committee on Health, Aged Care and Sport. The spokesperson added people with post-COVID conditions can access existing Medicare Benefits Schedule (MBS) items for the treatment. The government has also tasked the Royal Australian College of General Practitioners to update guidelines on caring for long COVID patients. The government also funded the establishment of the Australian National COVID-19 Clinical Evidence Task Force in April 2020, he said. This task force is developing clinical guidelines to provide recommendations regarding management and treatments for COVID-19, as well as the management and care of people with post-COVID conditions. The department is also working with states and territories to better understand the prevalence of long COVID in Australia. Latest studies on long COVID impact. It's not known how many Australians have long COVID, but one new international study estimates around 6% of people who have had COVID-19 still have health issues 3 months later. On average, the study, which used data from 22 countries, found long COVID symptoms persisted for 9 months in hospitalized patients and 4 months in patients who didn't need hospital treatment for their initial infection. It found 15% of patients continued to have symptoms a year later. Read more. Shadow of my former self, Tracy Spicer on suffering from long COVID. The official number of Aussies who have had COVID is now 10.3 million, meaning more than 600,000 could have ongoing symptoms. People who test positive no longer need to record their infection with authorities. A study in Scotland found 1 in 20 people had not recovered from having COVID-19 between 6 and 18 months later. Those who needed hospital treatment for their initial illness were worst affected. Plus, figures released in August revealed 31,000 Australians were off work every day with the debilitating condition. The same report also showed Australia lost 3 million working days in the first 6 months of 2022 due to the illness. Contact journalist Sarah Swain, @9.com.au.